Thanks, Terry, very much. As Terry mentioned, I'm honored to be on both the Cohen Veterans Bioscience and Cohen Veterans Network boards. Creating separate groups that would focus on both research and clinical care was a key part of Steve's vision as he imagined how he wanted to enter into this space. Steve's view was that 1 + 1 could really equal 3 if we could develop groundbreaking new developments on the research side and then quickly deploy them in the clinical care network. And then, even better, measure the impact through the electronic health record system that Anthony's been building out across that network. It's really a unique opportunity to build a learning environment that allows us to identify advances within CVB and then quickly translate them into an evidence-based practice approach within CVN. Yesterday afternoon, you heard about the wearable and mobile health program that we're spearheading. And I think this is just one example of how these tightly integrated organizations can advance the field for our veterans, and we're really excited by it. As you can imagine, both Anthony and Magali are incredibly busy running their respective organizations, but the fact that they make it a priority to come together on a regular basis with their teams to collaborate makes this network so much more powerful. And again, the sum of the parts is much greater than it might be otherwise. In that spirit, I hope that this conference has given all of you an opportunity to meet somebody you might not have previously met, learn something you might not have previously known, and hopefully that your future collaborations can similarly help advance the field that much better. With that, I'm going to briefly introduce the agenda for today. At 8:15 a.m., Admiral Lousy will give today's keynote address on advancing PTS treatment from a veteran's perspective. At 8:45, Magali will give you an overview of the roadmap for the future that she's developed for Cohen Veterans Bioscience. At 9:30, our good friend and collaborator from Stanford University, Amit Etkin, will tell us about his circuits first approach to PTS. At 10 a.m., we'll have a networking break. At 10:30, Allison Provost from CVB will moderate a panel on how computational modeling can help advance the field. At 11:30 a.m., Holly Lasambi from NIH will talk to us about how we can predict and prevent PTSD. At 11:45, our friend Moni DeLeon from the NYU Cohen Veterans Center will give us an update on the Tau diagnostics program that he's leading. And at noon, we'll return to the same location we were at yesterday for lunch, upstairs at the pavilion. At 1 p.m., Patricia Kubitsky from CVB will moderate a panel on PTSD translational models. At 2 p.m., Sabrina Beretta from McLean Hospital will update us on the Brain Bank program. At 2:15, Marie Steen from UCSD will moderate a panel on the future of therapeutics in PTSD, TBI, and suicide. And last, but certainly not least, we'll have closing remarks from Doug Haynes, who in addition to having a more than full-time job as the president of Steve's firm, Point72, has been a tireless coach, mentor, advisor, and board member for both CVN and CVB.